On today's edition of Know Your Health, we'll be talking about irregular menstruation. Irregular menstruation has become one of the topmost complaints we receive in our pharmacies and hospitals these days. And that's why we deem it fit to come on with this video to discuss the possible causes of irregular menstruation and the treatment that follows it up. Please, if this is your first time or coming across my channel, please do well to subscribe, put on your notification button on so that you will get notified anytime a new video is published. Like, comment, and share to your loved ones so that they can as well benefit from the information. First of all, how do you know that you have irregular menstruation? You may have irregular menstruation if time between each your period starts to change. If you bleed more or less during your period than usual. If the number of days your period lasts varies a lot. If you experience any of these, you then know that you have irregular menstruation. Then what are the possible causes of irregular menstruation? There are many things that causes irregular menstruation. Changes in the normal level of your hormones, estrogen and progesterone can disrupt the normal pattern of your period. And that's why young girls going through puberty and women approaching menopause normally experience irregular periods. Estrogen is the major female reproductive organ that is responsible for secondary sexual characteristics such as broadening of the hips, development of hair at the pubic region, and the enlargement of breast. Progesterone is the hormone that is released by corpus luteum in the ovary that is responsible for menstrual cycle and maintenance of early stages of pregnancy. When there is an imbalance in this hormone, you may experience irregular menstruation. Other factors including IUD. IUD is an intrauterine device. It's one of the contraceptives that women normally use to prevent pregnancy. It's a T-shaped rubber that is placed on the uterus to prevent ovulation. One of the side effects of this is irregular menstruation. Another factor is hypothyroidism. Hypothyroidism occurs when there is a low secretion of thyroxine from the thyroid gland, and when this occurs, it affects the normal pattern of your periods. Another factor is polycystic ovarian syndrome, that is PCOS in short, is a hormone condition that affects your ovaries, the female reproductive organ that makes eggs. This is one of the common causes of infertility in women. Once you have this PCOS, you may likely to experience irregular menstruation, acne, unwanted body and facial hairs. That means you may likely to have body and facial hairs like men. PCOS can as well put you at a risk of developing diabetes and hypertension. Another factor is a uterine fibroid. Uterine fibroid does 4 things to your uterus. It presses against your uterus, prevents contraction of your uterus, stimulates the growth of blood vessels, and elevates the production of hormone called prostaglandin. All this put together causes heavy bleeding during your period. Other factors also including pregnancy and breastfeeding. They are also an implicating factor in causing irregular menstruation in women. Birth control pills or contraceptives is also an implicating factor. Since the major causes of irregular menstruation here are imbalance in the hormones, the major treatment here is hormonal therapy. Your doctor can recommend birth control pills or contraceptives to help balance the hormones. In the case of hypothyroidism, you can as well recommend thyroid hormones. If you have a uterine fibroid, you can go for surgical removal of the fibroid, or he can as well recommend some drugs that could help to shrink the fibroid. If this is your first time or coming across my channel, please do well to subscribe, put on your notification button on, like, comment, and share to your loved ones so that they can as well benefit from the information.